is chapter 11. It's heart failure and then acute pulmonary edema, because they pair conditions together that sometimes can mimic each other. So we'll get started on heart failure. This is heart failure. Your heart is just pooped out. It has been trying to pump normally and keep you alive amidst all the, unhealthy things that we eat, unhealthy habits that we do, lack of exercise, and it just keeps trying to pump away. And one day, late in life, it just wears out. It just can't pump anymore. So 5 million people in the United States are said to have some kind of heart failure. It occurs when the heart muscle is impaired and no longer pumps sufficient blood to the body tissues and organs. It's just pooped and only can pump out just X amount instead of the full amount. This can result from almost any kind of cardiovascular disease. You can have heart failure. So a heart attack and hypertension are the most frequent causes of heart failure. So also associated with thyroid disease, renal insufficiency, which is kidney, and pulmonary disease from the lung, valvular heart disease, diabetes, and cardiomyopathies. So cardiomyopathies, pathies at the end of this word is like a condition of, and then you go back to the beginning of the word. Cardio is heart and myo is muscle. So it's a condition of the heart muscle is cardiomyopathy. So initially it presents itself during exertion. You're shoveling the sidewalk for snow, you're raking the leaves, you're mowing the lawn, you're moving things. It's with exertion. As the disease progresses, the symptoms occur even when you're at rest, and then you still have issues. So the 3 cardinal signs of heart failure are dyspnea, edema, and fatigue. And I would know those. It's difficulty breathing, swelling, edema, and fluid, and fatigue. So in the dental setting, physiological and psychological stress can exacerbate the symptoms. It can lead to pulmonary edema. It's when it's an abnormal fluid in the air sacs of the lung, and that leads to shortness of breath. The types of heart failure: you can have left ventricular heart failure, right ventricular heart failure, or both left and right ventricular heart failure. So this is a picture of the functioning of the heart valves and blood flow. You see the red and the blue, which would be right here. This is superior vena cava. This is going from the body into the heart, and it'll go from the body, which is oxygen poor blood vessels, and it goes into this atrium. And this will go from the lower part of the body into the atrium. So this is going to go right here. When the heart pumps, it's going to go through this valve. There's kind of like a little doorway there, and it goes into this ventricle. So at this ventricle, it is going to be pumped out right here to the lungs. It can go this way to the lungs, and that's where it's going to get it's going to be oxygenated again. So in that respect, then it kind of comes back. It goes from the lungs, and the red is always what goes to the heart. So then it's going to be oxygen rich and go ahead and come in through this atrium, and it goes through this valve and through the ventricle, and then it's pumped. It's kind of like you have to see in here, and it will be an aorta that goes out to the body and out to the body here. This is from the back side. So that's basically just a really quick synopsis of how the heart works. So in left side congestive heart failure or right side congestive heart failure, and they may call it heart failure or CHF, which is congestive heart failure. It seems to me that in recent years that they have kind of dropped the congestive part of this, and we'll call it right heart failure and left side heart failure. But if you see either one on a test, they may not have changed it on a test or boards. It may still say congestive heart failure. So it's all the same thing. So the left side congestive heart failure is when it's in the lungs, and you get pulmonary edema and effusion. You get a lot of edema, swelling, and fluid that's gathered in the lungs. And the right side is when you can have distended neck veins. You'll have distended neck veins here. You may be able to see that on a patient. And they can have an enlarged liver and spleen. So that's the main things that go on between the right side and the left side of the heart failures and what they cause. The other thing I wanted to bring up too that this right side can cause is that you can have ankle edema. See here where the ankles are just normal, and you see here where the ankles and the legs have edema, which is they'll be a little thicker, it'll be spongy, it'll be pitted. So what that means is you could put your fingernail or a pencil or something and lay it into the tissue, and it's going to depress the tissue and stay that way. So the left ventricular heart failure is an inability of the left ventricle to pump blood out to the body tissues. So they don't always that doesn't pump the full amount. So it results in a fall of cardiac output, which is of course containing oxygen for the rest of your body. So the left usually occurs always before a right ventricular heart failure. Blood coming to the left ventricle may back up, causing fluid to leak into the lungs. And so that is what is helping cause the pulmonary edema. So people with this left ventricular heart failure would have dyspnea, they'd have a dry cough, wheezing are classic signs of left ventricular heart failure. Symptoms of right ventricular heart failure usually develop after the left, results in the inability of the heart to pump blood from the systemic circulation, in other words, the body, into the heart. So this results in kind of congestion and a buildup of fluid in the venous system. And it will cause pitting and edema around the body, and especially in the lower legs and ankles and other areas. This is a classic symptom, is peripheral edema, and that's a classic symptom of right heart failure, right side congestive heart failure. These people, they're not getting enough oxygen. They're going to feel weak. They're going to feel fatigue. Nocturia, they're going to need to, they have an issue in the nighttime that they may have to get up and go to the bathroom a lot. They have a distended jugular vein, veins that just pop out. They have a reduction in kidney flow or renal flow, same thing. So the later stages of heart failure, you can have either right or left. You could have mental confusion, anxiety, restlessness, lack of oxygen to the brain, wasting of tissues, and maybe your lips and nail beds will be cyanotic, or you'll have cyanosis, which is a bluish color to the nail beds, toenails, and your lips. Treatment, what do we do? So they usually give ACE inhibitors to heart failure patients. So when you're taking down the medical history, if you see ACE inhibitors, you'll know that maybe this has possible. You can ask the patient actually if they have heart failure, or to tell you a little bit about it. And the ACE inhibitors are going to relax the blood vessels, which will help to lower the blood pressure. And they may be given diuretics. They may be given vasodilators, anything to dilate all the blood vessels. They are given a lot of times beta blockers and calcium channel blockers. So the beta blockers block the epinephrine, or another name for epinephrine is adrenaline, and it will block the epinephrine, which usually can kind of speed the heart rate up. Adrenaline can, so these beta blockers block the beta action of the body, and it can help slow the heart's rate. So the calcium channel blockers prevent calcium from entering the cells of the heart and blood vessel walls, and so then they relax and widen the blood vessels. So once again, anytime the blood vessels dilate or widen, there's going to be a lower blood pressure. Acute pulmonary edema. This is the most dramatic, life-threatening symptom of the left sided heart failure. Stress can help cause it, infections, failure to take the medications as prescribed, or a meal really high in sodium. It inhibits lung expansion, resulting in gasping for air. So when you breathe in, they can't expand their lung. It decreased ability of the lungs to oxygenate the blood, obviously, if that's happening. Acute pulmonary edema is, some people call it the death rattle. It indicates the very last terminal stages of someone who is like dying of acute pulmonary edema. As I cough. So symptoms and signs of acute pulmonary edema: rapid pulse. They'll have cool, moist skin, cyanotic lips and nail beds. They're bluish. Anxiety, difficulty breathing, dyspnea with cough that produces frothy, could be blood-tinged sputum, and they have loud, coarse lung sounds. So the treatment is you want to focus on the reduction of fluid in the lungs. If you sit patient upright, it redirects the blood to the lower extremities and relieves pressure on the lungs. So people with acute pulmonary edema, we would want to sit semi-upright or upright. Drug therapy, they give them diuretics, vasodilators from a medical doctor. From us, they may want some oxygen to go along with their cleaning, and severe cases may need to be intubated. But that, of course, would be in a hospital. It's life-threatening, pulmonary edema. You need to contact, if someone's having a hard time with that and exhibiting signs of that, a person doesn't just kind of come up with it. So most people are going to be able to put this on something about the lungs or pulmonary edema and on their medical history, and then you can go ahead and ask, like, when was your last, your worst episode? Is it controlled? What are you doing? All of that kind of information. So if they are exhibiting these kinds of bad symptoms during the appointment because they're filled with anxiety, and so this is creating havoc in their system, you want to contact EMS, of course, terminate all treatment. You want to try to reduce their anxiety, to reduce the cardiac and respiratory workload. So try to kind of calm them down, breathe deeply, and just calm them completely, and be very empathetic, as this is going to reduce the workload that's on the heart and lungs. Position the patient comfortably, probably upright, to aid in breathing. And of course, you're always going to be doing the CABs of basic life support. So in the dental setting, you would want to give them oxygen. This requires more oxygen. This is a higher level, usually 10 liters a minute or more, and monitor their vital signs every 5 minutes. This type of a patient can have nitroglycerin, 2 to 3 tablets or sprays every 5 to 10 minutes. And do not use this nitroglycerin if the systolic blood pressure is below 100 millimeters per mercury. So we've already kind of gone over that if the person has really low blood pressure, nitroglycerin is going to cause the a lowering of the blood pressure, dilation of the coronary arteries. So it possibly could, if you give them nitro, it possibly could lower their blood pressure to a dangerous point of like around 60 or 70, so which they could eventually go into cardiac arrest that way. So if they're conscious, you want to give them the nitro. If they're unconscious, you're going to place them laying down, and you are going to administer CPR. So if dyspnea, difficulty breathing, continues, you can perform what they call a bloodless phlebotomy. And this is where they place 3 tourniquets or blood pressure cuffs. You can use blood pressure cuffs. A lot of offices just don't have tourniquets lying around. So you can put blood pressure cuffs on 3 limbs, tight enough to reduce the blood flow, but loose enough to maintain a pulse. So you could put them on 3 limbs. You always want to leave 1 limb that is not covered, is just normal. So you could put it on like the right arm and 2 of the legs, or whatever combination that you are thinking. 6 inches below the groin and 4 inches below the shoulder is where the cuffs should be. And then they're changed out. When a certain amount of time has passed, then you would like move everything to the right. And then there'll be a different limb that is not covered by something. So you just kind of keep moving it around until EMS can get there. So here it is. You remove 1 tourniquet at a time every 5 to 10 minutes and reapply to a free extremity. So this removes blood from circulation, permitting the heart to pump the remaining blood more effectively. And it also results in reduction in pulmonary congestion and can improve breathing. But they call that a bloodless phlebotomy. So here would be an example that's in your book, but here would be an example to where they have the cuffs around 1 knee, down from the groin, 6 inches down, 4 inches from the shoulder, and they would have this, and then every 5 to 10 minutes they would just switch it to a free one. So that, in fact, ends this chapter.